Wonders.
Good evening. Good evening, Mariam.
Okay, good evening.
Good evening, ma'am.
Oh, yeah, thank you
Good
for
evening,
joining
ma'am.
us. Yeah, good evening, everyone. Thank you very much for joining us today. So before starting the section, I would like to introduce myself. So I am Nandita. I done my master's in nutrition and dietetics, and I'm carrying around more than a decade of experience as a dietitian and nutritionist. Okay. Before starting the section, just I wanted to, I'm requesting you to introduce yourself in the chat box so I can know more about your educational background and why you choose this course and all. You can use the chat box instead of saying. You can use the chat box each everyone. So, how many of you are from yoga background and your educational background? Why did you choose this course, and what do you want to learn from this course? I can see your name, Kavitaji, but I'm asking you your educational background and all, from which place you are. So please turn on your video so I can see everyone. I can remember your faces. Okay, good. Okay, Reshma Bhargav from Hyderabad, working as a child nutritionist. Oh, very good. Where are you working, Reshma ji? I'm also like, I worked with multiple hospitals, so I'm asking, just curious.
Not in hospitals, ma'am. Just I have my own clinic.
Okay,
But
good.
I took a gap from for 4 years because of my children, and they are
Okay,
in higher education now.
okay,
My elder one is going through the NEET coaching.
okay,
Younger
okay,
one is in 10th. So because of their studies, I just uh, kept apart for some time. My husband is a pediatrician,
okay.
so we both work in the same field.
Okay, good. Super, super. Okay. And Anjaya ji, sir, you're from Hyderabad. Okay. Reshma ma'am, you're also from Hyderabad. Good. And MSc Maths, very good. And Chitranshi Bajpai. Chitranshi ma'am, hi ma'am. And okay, good. And Chennai, work for defense. Oh, very nice. A passion in a practice yoga. MSc Yoga, very good. And Sheetal ma'am, good evening. I'm from Sheetal, psychologist from Warangal. Oh, from Hyderabad. Okay, good. Bangalore yoga therapist Kavita Reddy. Okay. Monisha from Madurai. Okay. This time a lot of people from Chennai, Tamil Nadu. That's very good. I'm seeing a few people from Tamil Nadu. Okay. Dr. Komati Satisha, MSc Yoga, okay, Professor of Computer Science and Engineering, oh, very nice. This time I'm meeting a lot of people from science, like mathematic, background. In my previous class, I used to, the students, they were most into yoga and doctors. Now this time mathematics are a different field I'm seeing. Sri Lakshmi from Hyderabad, housewife, very good. Okay, I think almost everyone introduced themselves. So before starting into the section, just I wanted to explain briefly about the syllabus, so which topic we will be covering in this section. Okay, so this course we designed to cover basics to little bit advanced. Okay, therapeutic conditions also. So we will start with the metabolism of carbohydrates, proteins, and fats, the role of that particular nutrient in our body, so importance of the nutrients and how much we have to take as per our weight and according to body type and according to disease condition. Okay, and we will discuss more about the nutrient micronutrient role in disease prevention. And most of the people they don't know much about the micronutrient role in disease prevention. We will be discussing more about that, and we will be discussing about these Ayurvedic treatments and Ayurvedic doshas. What is Vata, Kapha, Pitta, and according to doshas, what diet we have to follow. And this is also we'll be discussing. And therapeutic like diabetes and gut related issues and the cause of any diseases, how it is happening, what is the or what is the root cause of any disease in the body in Ayurvedic view and in modern science view. So we will be discussing in both views. Okay, because better to know more about Ayurvedic view and modern science also. We need to compare both of them for better knowledge. So we'll be discussing about that also. And along with that, we will discuss more about yoga and some few asanas, how it is helping to prevent any disease condition, and according to yoga and what asanas require what type of nutrition. And we can discuss more about sports nutrition also in this course. Okay, so this is suitable for yoga teachers, and if anyone is interested to learn more about nutrition, that is for them also it is very useful. For doctors it is useful, and any people are gym trainers and housewives, and any person wanted to know more about their health condition, this course is suitable for them. For this course for good for everyone. Okay, so we can learn more about the nutrition, because nowadays 70% of the population worldwide suffering from nutritional deficiency, and that might be micro or macro. Okay, any nutritional deficiency leading majorly metabolic disorders like diabetes, hypertension, cardiovascular diseases. Nowadays it is increasing by the time. So these disease condition increasing by the time because of the nutritional deficiencies. There are many reasons, and nutritional deficiency is one of the reason to get cardiovascular diseases, especially diabetes. Worldwide, India is leading in second place in diabetes. So most of the population, every home, 1 or 2 person suffering from diabetes. That is a metabolic condition. So compared to 60 to 70 years before, why nowadays many people are suffering from diabetes? Why that is becoming a part of our life? How we can prevent that? How we can reverse that? So in scientific view, so what foods we require to control diabetes, and in future how we can prevent from the diabetes. This is a metabolic condition, so that is also we'll be learning in this course. Along with that, we can learn more about recommended dietary allowances. Okay, recommended dietary allowances means each and every person require different nutrient dosages according to our age, our metabolism and all. Okay, we will be discussing that also. Many people may get confused about the nutrition intake, what we should eat per day. So what nutrients are important to prevent from any diseased condition, or if already they are suffering from any diseased condition, how they can cure that condition through the diet. That is also we'll be discussing. Recommended dietary allowances and BMI. What is BMI? What is BMR? Okay, how to make a diet chart, and how we can do calculation, any nutritive value calculation. While making the diet chart, what nutrients we need to consider. Okay, that things also we'll be discussing in this course. So mainly this is suitable for everyone, but your job is in this course. You need to you need to go through each and every material whatever I'm sharing in the group, and you need to practice yourself more, because this nutrition and dietetics course this is very biggest subject. It's very difficult to learn all of them in a month. Okay, that's why we are starting from the basics. We will start from the basics, and once we finish that, then only we can go into therapeutic. Not completely therapeutic, only we can prevent. In this course, we will learn metabolic conditions. That is more than enough. In month, we can learn that. And if you have any queries regarding this course, please ask me. Okay, so we can discuss more menopause, PCOS, PCOD, thyroid condition. Why nowadays people are suffering from thyroid, and most of the people, why women especially, why they are suffering from PCOS and PCOD condition. What is the main causes of that? What nutrients are important for that? In Ayurvedic view, so according to Ayurveda, according to Ayurveda, they discuss more about Vata, Kapha, Pitta. What exactly that is? So what dosha dominant leading to diseased condition. Okay. So according to dosha, what nutrients are important, what to include, what to avoid, and what therapies are using in Ayurvedic. Okay. And in Ayurvedic, what is the difference between Ayurvedic and modern era? Okay. This modern medicine are different, Ayurvedic medicine are different. But whenever we are discussing about the food part, there is no much difference between them. Okay. So medicine may be different, but the nutrient requirement and the nutrient doses are almost is the same. Only few restrictions are there. So what foods are required? So how we can prevent the disease, any disease, okay? And what nutrient we need to include more in particular condition. That is also very important to know. So we'll be discussing more about that. Okay, so if you have any queries regarding the diet and all, please ask me now. About the course, if you have any doubts about the course and the certification, anything you can ask me now. So I'm here to help you. Just today webinar, that's why I'm explaining. So any doubts regarding the course?
Some timings, ma'am.
Yeah, please.
Timings. What are the timings, ma'am?
Timings 8 to 9 only every day. 8 to 9. Are you comfortable for these timings?
Yes, ma'am.
Yeah, so you will get recording sessions also. You will get all the material PDF form in the group. Okay. After the session, I will share everything, whatever I'm explaining in the class. Na, I will share everything in the group. You don't need to worry. I will recommend few books also for better knowledge. So you can buy, and during your free time, you can read more about the books, because this is a huge update and we are dealing with our body. And food, a few foods work medicine for few people. The same food works as a poison for few people. So someone diet is not someone medicine. That is also very important to know. If if you open any YouTube or else any Instagram, you can observe many people promoting their own diet plan in the so on online platform. So from the morning to evening, I'm eating this and this much, that much. But that dosage is not recommended for everyone. Okay, for example, cabbage. If you use cabbage, someone mute yourself, please. Very disturbing.
One query, ma'am. Can I?
Oh, yeah, please. Actually, who?
Actually, like whatever syllabus you have been said, okay. But coming
Mm.
to something like mental health issues, so do we have any coverage of types in the
Yes,
mental
yes. We will,
in our
we will
syllabus?
cover that also. Depression, anxiety, mental issues, psychologically, we will discuss that part also. No need to worry. I will discuss everything. If you have any queries, if you want any new topics also, if you let me know, definitely I will add that also in the course. No problem.
Sure, ma'am.
And
Thank
we
you.
will.
And after completion of the course, so is it like will be called as a nutritionist or a nutritional consultant?
Just nutritional consultant, because the nutritionist, becoming nutritionist, that is different. Becoming a dietitian, that is different. So if you want to become a dietitian, you need to do 2 years course or 3 years course. If you want to do an you need no, it's take 3 years of time. And nutritionist, few are certified nutritionists, they do 6 months or 9 months. Few people do diploma, that is for 1 year or 2 years. So there are different type of courses. This is just for the knowledge purpose only, this 1 month course. But from Shubha Yoga, we will be covering all the topics, important topics, what really we required to survive and for our family, for our well-being. You can learn whatever you want in the group, in course.
Thank you, ma'am.
Someone mute yourself now. I'm not able to see them. Please mute yourself. I have little signal problem here, that's why. So nowadays, most of the people are, the main problem nowadays, people are so stubborn weight. And many people are trying for the weight loss. And whenever they are trying for the weight loss, many people, they're not choosing the right path. and many people are following online consultations without proper verification. Many people are calling themselves as nutritionists without proper knowledge. And weight loss, few people wanted to lose the weight within a month, 10 or 12 kgs, which is very harmful to the body, which may lead to severe conditions in the future also. So we are going to learn the difference between them and how we can reduce the weight in a healthy way without modifying any things. We don't recommend any fancy diets. No broccoli, nothing. For example, I'm saying if you're eating that blueberries, you will get the immunity. Not like that. Whatever available at our home, with that food only, how can we maintain our ideal body weight? How can we prevent from the diseased condition? These things we will learn more in this course. Okay.
And suppose in case like this is a 1 month course, no ma'am. Like I would
Yeah,
like
yeah.
to lose at least 2-3 kgs. So in this 1 month course, is it possible to lose, ma'am?
So what is the link for the waiting, losing the weight and this course?
Because
We will discuss about. Yeah,
I
please.
have a wedding next month, so family wedding. So I definitely need to lose at least 2-3 kgs. So is it possible in a month time?
It's no. If you want to, if you practice well, definitely you can know more about your body. You can lose the weight. You can make your own diet plan without consulting any dietitians or nutritionists if you attend every class in the course. So
Yeah.
I am not giving any promise that you can lose 2 or 3 kgs in a month, because we are only discussing about the subject. We are not discussing about the diet plan.
At least minimum 2 kgs I want, ma'am. And will you be giving our diet plan from the first day?
Actually, I don't provide any diet plan. I will ask you to make a diet plan by your own by providing the knowledge. That's it.
Okay.
Oh, you got my point, right?
Yes, ma'am. Got it. Got it.
Yeah, that's it. So I will help you to make your own diet plan. So just focus on the course and learn few things from the course. While making the diet plan, if you get any queries, definitely I will help you. That is
Is
my job. Making diet plan your
is
job. Correcting
this
is my job.
certificate valid, ma'am? Is this certificate
Sorry.
valid to give for my therapist? The certificate which we are getting now, is it valid? Like, is it recommended to give the diet plan to my therapist? I mean, for my patients?
This is actually this course only for the knowledge purpose only, and it's very difficult to make a diet plan for your clients without proper knowledge. If you're practicing yourself properly, if you're reading biochemistry in depth, if you know the concept of the what is nutrition, the recommended dietary allowances, if you're using dietary principles, definitely you can help your clients to achieve their goal. No issues. That's why in this course we will be covering recommended dietary allowances. And if before planning any diet plan, you should know what is BMI, BMR, and what is metabolism, and why few people are reducing the weight, why few people not reducing the weight following the diet by following the diet and any exercise. So we should know that also in scientific way. Then only you can make a right diet plan. If you are confident about you can recommend the diet plan. But you can't be a dietitian or dietitian. That the requirements, the education qualification is completely different. This 1 month course especially only for the knowledge purpose. That's it. You got it right? Please turn on your videos. I'm not
Got
able
it.
to see anyone.
Ma'am, if I turn off my video, like I will not get the network. That is why.
Yeah, I do have some network problem because in Andhra Pradesh we do Sankranti. I came home.
Yeah,
So
yeah.
once I go back to Hyderabad, definitely I don't have any problem with the network. Here I will get the problem.
Yeah. Here it is same, ma'am.
Okay, okay. Okay, anyone have doubts? Doubts about the codes and all? Because
Ma'am, are you from AP?
Yes, I'm from Andhra Pradesh. I'm from Tirupati.
Oh, congrats. Happy Sankranti,
Yeah,
ma'am.
so thank you.
I'm from border, ma'am. Khammam.
Oh, Kammam, I know. I'm from Andhra, but I live in Hyderabad.
Okay, okay. Nice to meet you, ma'am.
Likewise, thanks. Okay, so I have some. Any doubts? Any other doubts? Now you understood you you understood the course, right? What topics we'll be covering and what is the role of nutrition in disease therapy, disease prevention, okay? And what nutrients are important. Everything we will discuss from the basics. We'll start from the carbohydrates, we end with any therapeutic condition. Okay, no need to worry. We will discuss each and every nutrient. What is vitamin A? For example, the role of vitamin A, the doses of vitamin A. So with vitamin A, what type of diseases we can prevent? Each and every topic we will discuss in the course. Please keep yourself one pen and book with you because we will discuss more topics, we will cover more topics, so you better to write down whatever I'm explaining because it's give more knowledge. And whenever you wanted to make you wanted to make a diet plan for yourself or for your family, so you can open that notes and you can gather, you can see the important points from the notes. So what nutrient important for what specific condition, so based on that you can include that simple food in your diet. So writing down is very important in this course. Many people don't do that, but personally, I'm recommending you to do that. Okay.
What is the course fee, ma'am?
So any doubts? Course fee? I have no idea. Please confirm with Raji sir. I don't know much about the course fee. I think
Ma'am,
that
how many assignments we should we submit by the end of this program, ma'am? Course?
only I will give you one assignment,
Okay, ma'am.
but so end of the course you have to submit only one assignment.
Okay, ma'am.
During the course, I will ask you to make sample diet plans also for better understanding, for better knowledge. And if you're not,
Any recipes or anything like that also, ma'am?
yeah, whatever comfortable for you, and I will ask you to make a diet plan from morning to evening with nutritive values
Okay, ma'am.
for better knowledge. Okay. So that is
Okay.
very important. If you try to make a diet plan, definitely it would be more helpful for you to more about that condition, and you will learn more about the nutrients dosages. That is very important. Many people don't do that. But if you're not making any diet plan, if you're still getting confused, what is the use of joining this course? That is my point. And many people, they get confused. I'm always here to correct you whenever you are making a right diet plan. Sorry, wrong diet plan. I'm always here to correct you. That is my job here. And your job is following the classes without file. And whenever I'm asking you to submit the assignment, you have to do that for better knowledge. This is only for the improve your knowledge. That's it, nothing more than that. Okay? Okay. Moisha Chitranand. So, any doubts?
No, ma'am, it's fine.
Ma'am,
Okay,
will
okay,
you
thank
teach
you.
diet
So,
plan for knee pain and eyes problem and digestion?
someone asking something?
Yes, ma'am.
Yeah, please.
Ma'am, will you teach how to make diet plan for like knee pain and digestion and
Yes.
eyes problems? Because
Yeah,
I am suffering
everything.
from knee problem.
Yeah, everything we'll discuss, no issues. Every top.
Okay.
So, 90% of the diseases in our body is manifesting because of the leaky gut. Okay? The gut issue, unhealthy gut leading to many diseases in the body. So what is gut? So what nutrients are important for the gut health? By improving our gut health, how many diseases we can prevent and we can cure. That is also we will discuss in this course. So if you're not understanding about the gut, you can't make any diet plan, and it's very difficult to know more about the diseased condition. So that's why gut health is very important. That is heart of the course. Definitely, we will discuss more about the gut health. But whenever we are starting the course, we will start only with the basics. So basics means what is yeah, Chitranshi ji, please.
मैम मैम आवाज आ रही है मेरी?
Sorry?
हेलो मैम आई
Yeah,
वांट टू
please.
आस्क क्या कुछ ऐसा है जो कि डेली क्लासेस करने के बाद भी समझना मुश्किल होगा?
समझने मुश्किल होगा means?
क्या ये कोर्स इतना टफ होने वाला है कि समझ में ना आए अगर हम डेली क्लासेस लें उसके
No,
बाद
no, it
भी?
is not that. No, actually, it is not that tough. But if you want to go through recording sections, if you want to attend on daily basis, if you attend on daily, what is the benefits you will get? So you will understand the subject more.
With
That's the
practice,
that.
I can learn how to make for myself, na ma'am?
Yes, exactly. You
Okay, ma'am.
can make your own diet plan. You can help you can help your family members also. So
Okay,
actually,
ma'am.
in India, uh, worldwide, I don't know exactly, especially in India, educated, uneducated, irrespective of their educational status, okay, educational status, many people are not aware of the nutrition. Okay, many people get confused what they eat, how much they have to eat, and there are important nutrients role in disease prevention. So each and everyone, they should know the importance of nutrition. So this course is specially for them only. Okay, because even for example, what I observed, many people, they are holding very nice degree like engineers or whatever it is their educational background, but they're also consulting very wrong person on social media for the right diet plan because they still don't know what to eat, what not to eat. So by joining this course, you can know more about the food choices what you are making in daily routine, and the modifications what we should do while making a diet plan while we are eating. Okay, at least this the useful knowledge you will get from this course. You can make your own diet plan because we will be discussing each and everything in this course. In our in Ayurvedic view and in modern science, allopathic view, both.
Ma'am, anatomy, physiology also would be covered.
We will cover only physiology, not anatomy. It's take a lot of time. We don't cover even biochemistry also, but I will touch the basics of biochemistry. I will touch the carbohydrate metabolism. We will discuss more in biochemistry way, but not in depth. We will touch what is required. That part only I will discuss. The anatomy, I will explain anatomy whenever we are discussing about the calcium part. I don't discuss much about anatomy. It's take a lot of time. And in this course, that is not included. We can discuss more about this dietary recommendations, about the diseased condition, what nutrients are required to prevent from that particular diseased condition. That's it.
Ma'am, to remember these medical terms and all, will it be like easy or like how?
I don't I will explain in not that so depth in medical terms. I will explain in normal simple terms only. Don't need to worry. Just whenever you're getting confused, just write down. That's it.
Okay.
Okay, so I know no more, no, not depth in medical. We will discuss about the subject, but we don't use more medical terms because people get confused. The same medical terms I will explain in normal language. That's it. Normal thing.
Madam, classes Monday to Friday only.
Yes, sir. Monday to Friday. Sometimes I will take on Saturday also. It's depend on the students.
Okay.
Okay. Sometimes only. So most of the time only we will conduct from Monday to Friday. Saturday, Sunday, it is your own time. You can practice yourself more. And any doubts you can ask in the classes. So I'm always here to explain you more about that specific doubt. Any like if you have any doubts while making a diet plan or while preparing for yourself, we can discuss more about that also.
Okay.
Ma'am, duration of the course, ma'am?
It will be for 1 month.
Okay.
It is 1 month course. So in 1 month course, we will be covering these topics. And at least, we'll understand more about this nutrients role in disease prevention, how important it is. And many people are not aware of that. So by this course, we will learn more about that. And fortunately, we are adding these diabetes and all also in many. So it's very difficult to discuss all those topics in a month course, but we will be covering in this course because diabetes is it's becoming very it's it's becoming and it's more than a population worldwide more than 70% of the population by 2050 there are chances to affect from the diabetes, so we are discussing more about that part. So how can we prevent diabetes? And what nutrients are important to maintain glucose levels in healthy ranges? That is very important. We will be learning in this course. Okay. Any other doubts? And we discuss about the symptoms, the root cause of the disease, and medicines. In some condition we will discuss of the medicine also, and the food and the dosage, the recommended dietary allowances. This part we will discuss more in this course. So no need to worry, no need to stress yourself. Just listen, just go through the PDFs, just make a diet plan yourself whenever you're free for better understanding. That's it. Course start from today only. This is webinar. Today is webinar. Okay. Okay, so today let's discuss about the basics of nutrition. So mainly this nutrition is divided into two parts, okay? Macronutrients and micronutrients. What is macronutrients and what is micronutrients? We will discuss more in this in today's topic. So how many of you know about the nutrients? What is macronutrients? How many of you know?
Carbohydrates, proteins, fats.
Good. That is macronutrients. Very good. And micronutrients, vitamins and minerals. Okay. These macro and micronutrients are very important in disease prevention, and these nutrients are very important for body nourishment. Okay. So carbohydrates, proteins and fats, we are considering that is as a macronutrients because we require those particular nutrients in larger dosages compared to micronutrients. Okay. For example, if any person wanted to survive, they should include 40 to 50% of carbohydrates every day in their diet. So that is the importance of carbohydrates. Why carbohydrates are very important? To do any work, to talk, to sleep, to walk, to do any work, we require carbohydrates because from carbohydrates we are getting energy. Carbohydrates means energy giving foods. So to do anything, we require carbohydrates. That's why we require 40 to 50% of carbohydrates every day on daily basis. Okay. Proteins are very important nutrients, and protein very important for the tissue repair. Okay, for the tissue repair, for body building, for to improve hemoglobin levels and to reduce infections from the body, and it produces antibodies. Okay, it improves immunity and it balance hormones. The protein role also completely different in our body. That's why to improve our lifespan, to improve stamina, and for good muscular body also we require proteins. So that's why proteins also considered as a macronutrient, because we require proteins at least 20 to 25% from our diet on daily basis. Okay. And fats. How many of you know the important of fats in our daily routine? Many people consider fat as a bad, but fats are not at all bad. How many grams of fat every day we are consuming is very important. So without fats, if we are not including fats in our diet, what happens? It blocks absorption of many micronutrients, vitamins like A, D, E, K. For this vitamin absorption in your body, we require fats. Okay, not only for that, for anti-aging look, for heart health, okay, for skin health, to reduce dryness from the body, from the skin, we require fats. At least 15% every day we should include in the diet. Fats. So what type of fats we are including in the diet? So how much quantity we are using, from which source of fats are very important, that we should know. Okay, if we know that, we definitely add more fats in the diet. Fats are life-giving foods. So many people think that having, including fat, it we gain the weight, but that is wrong. By including fats, we don't gain the weight, but including more fats, okay, including more saturated fats, means unhealthy fats, including them, definitely it leads to obesity. Now you understand, right? You understood, right? What is macronutrients, the importance of macronutrients. You don't need to worry. We will discuss about the carbohydrate part separately, protein separately, fat separately, and vitamin minerals also. We will discuss this part also separately. Each and every nutrient role in the body. Okay, and from 1 gram of carbohydrate, we will get 4 calories. From 1 gram of protein also, we will get 4 calories. And fats, from 1 gram of fat, we will get 9 calories. For example, if we are adding 10 grams of fats every day, for example, if we are adding 10 grams of 10 ml of oil, so how many calories you are getting? 1 ml, 1 gram of fat will give 9 calories. For 1 ml, if you are adding 2 tablespoons, how many calories you will get? For example, if you are adding 10 grams of fat, so how many calories you are getting?
90 gram. 90.
Yeah, 90. So that's why we should, before we are consuming that, we have to mind the calories
Ma'am,
also. So from that
how
food, how many
important is
grams?
that kitchen scale to keep, ma'am? Is it required for the kitchen scale to weigh for the calories and all?
Yes, yes, because now you are learning this for the first time, right? You will get confused. You better to keep that in your kitchen. Once you get habituated, you don't need that anymore. But whenever you're starting for the first time, you better to keep that for the better measurements and all. And we will discuss more about that also in this. So from 1 spoon, how many grams? For example, 1 tablespoon is equal to 15 grams. 1 teaspoon equal to 5 grams. Like that, I will discuss about also that also, and which vessels we have to use for cooking. Okay, what vessels we are using for cooking also very, very important. Okay, the nutrient absorption, the nutrient destruction, everything depends on the cooking material also. That is also we'll discuss. That is very, very important.
The
Okay.
calories, like, is it like how to like count calories, ma'am? How many calories can we have per day? Like, is it
Yeah,
based
yeah,
on?
that's depend on our, yeah, that is based on our BMI and BMR. So we will discuss that later. Based on BMI, BMR only, you can calculate yourself how many calories you require per day. So before that, you should know the basics of the macro and micronutrients, the importance of the particular nutrients. Then only you can, you can get the knowledge about the BMI and BMR. Without that, you can't get the knowledge. That's why we are starting with the basics. So what is carbohydrates? What is proteins? What is fat and macronutrient like vitamins and minerals? If you understand that, you can understand that much better. Okay, no need to, we will discuss everything in this course. Okay, so from 1 gram of carbohydrates, how many calories you are getting? 4 calories. And while making the diet plan, this calorie count is very important. Okay, and from protein, 1 gram of protein we are getting 4 calories. From fats, 1 gram of fat giving 9 calories. Okay, so for example, already I have discussed about the carbohydrates, the role of carbohydrates in our body. So whenever you are eating, for example, if you are eating a rice, compared to any other nutrients, rice is good source of carbohydrate. For example, if you're eating 150 grams of rice every day, so from that, how many grams of carbohydrates you are getting? That we need to check. For example, if you're not adding any carbohydrates in your diet, what happens? It reduces brain function. Many people, what they do, they consider carbohydrates as a poison. They don't eat much. And if you consult any, that nutritionist or any people though, who is not holding that degree, if they don't have proper knowledge, they always suggest to you not to eat carbohydrates. But what happens if you're cutting down carbohydrates from your diet? For weight reduction also, for weight management, for fat management, whatever it is, if you're cutting down carbohydrates from your diet, it leads to gallbladder stones in the future, and it reduces memory from the brain, because 70% of the brain function depends only on the carbohydrates, and our brain utilizes the energy only from the carbohydrates, not from the fats, not from the protein. That is very important. Carbohydrate, without carbohydrates, the protein metabolism in the body will not happen. So that's why carbohydrates are very important. So many people, whenever they are trying to lose the weight, they cut down the carbohydrates, but cutting them completely is very dangerous. Okay, we need to cut down the carbohydrates from the diet whenever we are trying for the weight management. But how many grams of carbohydrates we need to cut down from the diet, I will explain in this course. Okay, while making a diet plan, how many grams of carbohydrates we need to cut down the from the diet to reduce the weight or to manage diabetes, whatever the condition is. We will discuss more about that in this course. Okay, and proteins, the role of proteins already I have explained. What is the role of our proteins? The role of proteins is, it's mainly, this is very important nutrient, because for bodybuilding, for the tissue repairs, to regenerate new red blood cells. Okay, new red blood cells to reduce infections from the body, and for the stamina, for hair strength, for beauty purpose, whatever it is, protein is a very important nutrient. So from protein also, from 1 gram of protein, we will get 4 calories. But here, if you observe, carbohydrate role is different, protein role is different. Okay. So for example, if you are taking more protein, if you are cutting down carbohydrates, what happens? Our body utilizes energy from the protein also, because protein also giving us energy. Right, it is also giving calories, it is also giving energy. But the protein role is completely different in our body. That the protein has to repair the tissues, it has to build the new red blood cells. So that is the difference. That's why we shouldn't depend on the proteins for the energy purpose. Okay, for the energy purpose, we have to depend only on the carbohydrates. For remaining things to do in the body, we require proteins. One healthy person requires 0.8 grams of protein per day per 1 kg body weight. 1 kg body weight, one healthy person requires 0.8 grams. And this protein requirements changes based on their diseased condition. For example, for diabetes, the protein requirements are different. For PCOS, PCOD, the proteins are different. And any person wanted to build their muscle, for athletes, for sports person, for them, the protein requirements are different. Okay, based on the requirement, we need to change their intake of the particular food. So that is also very important. And fats, 1 gram of fat giving 9 calories. For example, if you're taking 30 grams of fat every day, how many calories you are getting? Approximately 300. Okay, not 300, around 270 something. Okay, 270 something you will get by adding 30 grams of fats every day in your diet. So that is not recommended for everyone. Is that fat intake, protein intake, carbohydrate intake depends on the person physical activity, their metabolism rate, their genes, and their correct BMI and BMR. Okay, this is very important to know before taking the particular nutrient in particular dosages. That's why BMI and BMI is very important. And what about vitamins and minerals? Many people ignore this part, vitamins and minerals, and many people not aware that 70% of the diseases nowadays, that metabolic diseases or chronic diseases or like cancer, whatever it is, it's only happening because of the vitamins and mineral deficiency in our body. So we better to know how many grams of vitamins we require and what food we should take more to prevent from the vitamin deficiency is very important. If you observe nowadays, many people are suffering from vitamin D deficiency. Out of 10, 7 or 8%, 8 people are suffering from vitamin D deficiency irrespective of age and gender. And in India, we are getting good sunlight. Still, we are getting the deficiency of vitamin D. So why? That is also we should know before before knowing about the vitamin D. So why many people are suffering from vitamin D deficiency, and what is the link between vitamin D and weight management and stress, depression? This is also very important to know. We will discuss in this course. Okay. And
Ma'am,
vitamins and minerals. So that role are. Hello?
my
Yeah.
question was like, um, if it is not possible for working persons to prepare all this food, like will the supplements is recommended?
We do recommend supplementation when the person is diseased in therapeutic dosages. For example, I am suffering from eye related. For example, I have vitamin A deficiency. Okay, so vitamin A deficiency it reducing my eye health and it becoming it making my skin more dry. In that case, along with the food, I should add the supplements because we require the particular nutrient in therapeutic dosages, and the therapeutic dosages, if we are not getting through the diet, we can add supplements, no issue in that. Okay, and we will discuss about the supplement recommendation also in this course. So, how the doses of supplementation, to whom we should recommend the supplementation and all, and supplements also plays an important role in in a few conditions. That is also we will discuss, and not only for the working people. That is only recommended for the therapeutic conditions, but. If any person is they're not having that time to make a meal plan, we will give the options also, very simple options we will provide in the course. So from that food, what nutrients are they getting? Actually, we don't need to cook whole the day, lunch, breakfast, and dinner. We better to include foods, whatever For example, if adding more, just give all the vitamins. You don't need to cook a special meal for the breakfast. Instead of the breakfast, you can go with the fruits. But fruits are not recommended for the diabetes. If you're recommending diabetes for fruits for the diabetes, definitely it spikes the glucose levels. It may lead to serious complications. So, to whom we have to recommend that, we will discuss more in this course. Okay. Today, just webinar. So, we can't cover all the topics. By that time, we will discuss each and every topic. Okay. Carbohydrates, proteins, and fats, everything we will discuss. No need to worry. So vitamins and minerals, from where we are getting vitamins? By including more fruits and vegetables in the diet, we can get good amount of vitamins and minerals. Okay, vitamins means vitamin A, vitamin E, vitamin C, and it is called as a powerful antioxidants also, from the to prevent from the infections, from the diseases, and from the foreign bodies. To prevent from the foreign bodies also, we require immunity. So from where we are getting immunity? By adding good amount of vitamins and minerals in the diet. It works as a protective foods. It works as a protective foods. Okay, vitamins and minerals, minerals called as a protective foods. So how many grams of white vegetables and fruits we have to add in the diet, that is also we'll discuss more. But knowing more about vitamin role in disease prevention and including them on daily basis is very important to prevent from any disease condition. Okay, and for weight management, for diabetes, and for fertility, for everything we will discuss more in this course. Okay, that is the role of vitamins and minerals. And fiber, so from where we are getting fiber? So including more green leaf vegetables and cereals. This is very important because these foods are very giving fiber to reduce constipation, piles, fistulas, and weight management, for gut health, for everything we require fiber. If you're not including more fiber in the diet, it leads to serious complications. It leads to constipation, and constipation is root cause of all the diseases. So how many of you know that constipation, it reduces our nutrient absorption from the body, it reduces gut health, and it leads to obesity, it leads to metabolic conditions. If any person suffering from constipation, they must check their diet. Okay, they must check their diet. If they have any intestinal infections also, it may leads to constipation, but constipation is root cause of all the diseases. If you are not eliminating the toxins from the body, definitely it only stucks inside our intestine. That time what happens? Whatever we are eating, yeah, if we are eating the food, the nutrient absorption may be reduced. Okay, if the nutrient absorption is not happening properly in the body, what happens? There is no use by eating healthy food also. Okay, that's why fiber, including more fiber in the diet, is always helpful to reduce the constipation and diabetes, cardiovascular diseases, and any gut related issues, and it always very helpful for the ideal body weight also. Okay, that is the role of fiber. And drinking water, many people, they neglect, they don't drink much water, they neglect this part. But if you're not drinking good amount of water, what happens? It for nutrient absorption, for proper metabolism, water is very important. If you're not drinking sufficient amount of water, definitely it leads to migraines, it reduces brain function, and it leads to high dehydration. Okay, and it leads to constipation also. If you want to pass the food through our intestine, water is very important. Every 20 kg of body weight require 1 liter of water. So the water intake also, it is different from person to person. Okay, it's depend on our weight, and few people may suffer from water. You don't need to reduce water intake during winters. Okay, during winter also we require good amount of water only. Every 20 kg of body weight require 1 liter of water. For example, 100 kg person, they can take up to 5 liters of water. And few people suffer from water imbalance in the body. In that case, they can drink a lot of water also to balance their electrolytes in their body. So along the water, they can add little more other things also, like buttermilk and pH balancing foods and all. I will explain that later. Okay, drinking water during winter, during summer, in both seasons, that is very important. You should drink sufficient amount of water during winter also, because during winter, if you're not drinking good amount of water, it leads to Pitta dosha. Okay, it leads to Pitta dosha. It affect on the metabolism. That's why drinking water is very important. Okay. So carbohydrates. So from 1 gram of carbohydrates, we are getting 4 calories. This is better to remember. And proteins also, 1 gram of protein giving 4 calories. Fats 9 calories, and vitamins and minerals. The role of vitamins and minerals are very big subject. We can discuss more in detail. Okay, and fiber, the important of fiber also, and I will explain more about the fiber intake. How many grams of fiber we have to take. These requirements are different from the age and from the gender, and that requirements are different in disease prevention also. We can discuss more in this course. And water parts also already I have explained. 20 kg of body weight require 1 liter of water. That is very important. So regarding that, if you have any queries, please ask me now. Today we only discussed the macro and micronutrients. Tomorrow we will discuss each and every nutrient in detail. So if you have any queries, please ask me now about this. No?
Excuse me, ma'am. How to identify the person is Vata, Pitta, or Dosha? Just now you
Yeah, I
said
will.
the.
Yeah, I will. We can discuss that in the course.
Thank you.
Okay, we will discuss about the Vata, Kapha, Pitta, symptoms of this particular dosha, dominant and all. Okay, we'll explain. I think if a person drinking 3 liters of water, 3 glasses of water, and then have to go for the fresh up, then what disease? So we can't say that. If any person's from kidney problem or diabetes, their their symptoms are different. If a person drinking 3 liters of water at a time, definitely they go for the washroom. That is quite common. We can't say if the person is suffering from any disease, but during the day only, if the person only drinking only 3 liters of water, that we can discuss. No doubts, right? About carbohydrates, proteins, fats, and vitamins and minerals. Everyone understood, right? The important of this, like how many calories we are getting from that particular. And tomorrow I will discuss more about carbohydrates, which food sources are rich of carbohydrates, proteins, what foods we are getting proteins, fats, and all. I will discuss in tomorrow class. Okay, after this I will explain about Vata, Kapha, Pitta, that also. But before knowing about that, you better to know this. Okay. Okay, no doubts. Okay. Thank you so much for joining today. We can meet in tomorrow class and we can continue the same topic. Okay.
Okay, thank you, madam.
Thank you, sir. Thank you so much for joining us.
Thank you,
Tomorrow,
ma'am.
same timing. Okay. 8 to
Okay.
9.